Welcome. I'm Julie Thompson, Executive Director of PACTV, and today we're hosting a COVID-19 update for the town of Pembroke. We're hosting these forums every Tuesday and Thursday at 9 a.m., watching Pembroke on Comcast Channel 15 or online on our streaming channel by visiting pactv.org/live. To ask questions during the forum, please email them to pembrokeinfo@pactv.org. For the forum replay schedule and additional Pembroke meeting coverage, please visit pactv.org/Pembroke. Sabrina Chilcott, Pembroke's Assistant Town Manager, will moderate the forum and will introduce the participants that are contributing today. Welcome, Sabrina.
Thank you, Julie. Good morning to you.
Good morning.
We're all having fun with technology these days, aren't we?
Oh, yeah.
A quick recap to the folks who are tuning in. The town of Pembroke has resumed slowly some of the regular board meetings and began last night at 7 o'clock with the planning board. Chairman Becky Cullity did a beautiful job moderating. They had a quorum. They addressed some of their ongoing public hearings regarding some zoning bylaw amendments that were proposed for the original town meeting warrant, and did manage to move forward and close the hearing on the FEMA flood map zoning amendment change in the warrant that will change the citations of some of the maps referenced therein. So that'll be interesting, and we'll see as that goes forward. There's a hard deadline on that, so they wanted to get that moving for the Board of Selectmen, and I'm sure everyone's very grateful. So as we take a look at this week in the news and in Pembroke specifically, we have a lot of activity that's happened since last Tuesday when we all got together. Today with us again, thank you, our Council on Aging Director, Gretchen Emmets. Good morning, Gretchen.
Good morning.
The Pembroke Housing Authority Executive Director, John McKeown. Good morning, John.
Good morning, Sabrina.
We have Health Agent Lisa Cullity, who has been very busy this week. Hi, Lisa.
Hi, good morning.
And good morning, Representative Cutler. It's very good to see you. We have some questions today. Thank you. Thank you for joining. All right, so as we get started, we're going to start with Lisa. Lisa, the emergency management team, as we've discussed several different times, has come together every morning at 10 o'clock on the weekdays to discuss things that were observed the day before, any orders or changes from the state, and what the caseload looks like, challenges with tracking and coordinating every day. We have the Council on Aging Director and Housing Director there with their input regarding the activities that PEMA saw over the weekend. Because as we go forward, we're not day to day, we are forwardly thinking and planning, but we have to react to what is happening every day in the town. So between Friday and Monday, what did PEMA notice around the town of Pembroke?
Sure. So the biggest things that we're keeping track of is one, are people social distancing. Obviously, social distancing is our biggest weapon against this pandemic, and it's the best way to not have issues of disease spreading among our population. So that's the first thing we look for. And over the weekend, by and large, social distancing was adhered to pretty well. The second thing we're looking for is when people can't social distance or social distancing becomes a challenge, are people taking precautions to protect themselves and others, which is, of course, what led to some new decisions that I know most folks got a call on. And this right here. And this is the requirement to now wear facial coverings in all essential businesses. This does not mean you need to put a facial covering on to walk, down the street or to walk in a park. That's not what we're talking about. We're talking about when you are in an essential business where there is a good likelihood that even with the best of intentions of social distancing, there are going to be challenges, such as if you're in a line, and can't quite maintain distancing, or if you were to pass someone in an aisle. Obviously, social distancing would be a challenge at that point. So it was the recommendation of the Board of Health, specifically the Chairman, Thomas Driscoll, but two of the board members are both in full support of this item in order to prevent the spread of COVID and protect, most importantly, all those essential workers. A lot of people are confused that masks are somehow to protect them. Masks do not protect you. They are to protect others from you. So it is important that we protect those essential workers that are showing up every day to work in our grocery stores, in our construction industry, in our other essential lines of services. It's important that they are protected from the public. We already know that we have 2 fatalities in the Commonwealth of grocery store workers that were exposed at work. So we are trying to eliminate those possibilities and keep those essential workers as safe as possible. And the business community has been wildly supportive of this. Grateful for it, welcoming it, happy that it's here.
Can I dial it back one step and ask you, this came about as we saw other towns in our surrounding area come to the same decision. And as everyone's trying very hard and working, relentlessly to be in concert with each other so we can be as smooth as possible. And I'll ask the rep about that later, because again, he represents so many towns, and I wanted to ask him in a moment, how that's working. But we were seeing some other towns make some decisions. Some were going forward, some were not. And this was brought forward from Board of Health to Emergency Management. Can you talk a little bit about how the decision was discussed, how it was implemented, and what that looked like from the inside perspective?
Sure. So all of those things come into play. Obviously, no community wants to be wildly out of consort with other communities around it. That creates confusion for the public. It creates confusion for someone that might be grocery shopping or looking for specific items, and perhaps a store in their community doesn't have them, so they're going to another community to get those items that they need. So there's a continuity that you want for the public at large. You want to keep it simple. You want to keep it easily adhered to. And community after community around us were moving to the facial covering requirement when in essential businesses, of course, essential businesses being the only ones open right now. But on top of that, it was also common sense. We were being approached by store owners and store operators with concerns for the safety of their staff. And then the last part of it is, you alluded to the fact of when we get to reopening different businesses. I think that we know COVID's going to be around for a while. It's displaying all the hallmarks of being around for a while. So if we're going to open other businesses, how are we going to do so safely? Because obviously the idea that we're going to perpetually close the Commonwealth for the next however long this is here is not going to work either. So the idea of facial coverings and getting people accustomed to wearing them, accustomed to using them, and what they provide for the public as well as essential workers is a template to allow us to start to bring other businesses back online, which is going to be so essential for the economy, for the workers, for so many things. So the facial coverings are a 3-pronged thing. And then, of course, the Board of Health, in consort with PEMA, the chairman attended a meeting. There was many discussions about it. And the only last thing I'd like to touch on is no one did this lightly. This wasn't oh, heck, let's go do facial coverings because it's a good idea. No one in the room wants to infringe on any sort of essential rights of any person. However, we have to look at the good of the community or society as a whole, however you want to look at it, and try to protect everyone as best we can. So there was much discussion. There was much idea of what it should or shouldn't look like, and ultimately we came out with a template that was very much in conjunction with other surrounding communities. And ironically enough, even as we were discussing to do this, the communities of both Kingston, Duxbury, Marshfield had just done it the day before, but all the communities around us were going to this. Hanson had preceded us by a day or two, so this was very much in conjunction with the other communities around us, and most of the regulations from community to community are extraordinarily similar.
Thank you. Now, John, I'm going out of order. I apologize. I want to give you a second to unmute. You specifically, when we had this conversation in the emergency management meeting, there was so much back and forth because, again, to Lisa's point, she's right. The rights of the individual and how people feel personally about donning a facial covering are, in fact, very important to everyone in Pembroke. That's the kind of town we are. Right? We're not changing. We're not becoming something else.
Right.
But one of the things that was shared from housing is the concept of people living in close proximity and having those common areas be protected, particularly when someone from the outside may be making a delivery or coming through, and having the opportunity to discuss that with your residents came up. And the order from the Board of Health under item number 6, I believe.
That's
does-
right, paragraph 6.
Exactly, exactly. Can you talk a little bit about that? And again, I understand everybody was pretty adamant about their position, and once it was talked through, some of the benefits outweighed some of the uncomfortable aspects. Can you talk to that a little bit?
Yes, thanks, Sabrina. I think that Lisa stated it very well, and you can't possibly understate or underscore how vigorous the debate was. Indeed, there was a lot of, I think, well-informed minds that debated the matter deeply. And you're correct, Sabrina. Civil liberties, no one wants to infringe on anybody's. We all want to live safely and get through this together and not lose anybody. Paragraph 6 requires any commercial or residential community greater than 1 unit. So the housing authority, any public or private residential community, it's going to require that they have to wear a face covering. The residents therein and any visitors that come upon the premises are going to have to wear a face covering no matter what. A few weeks ago, we imposed a guideline for all healthcare visitors or delivery services, whether it be food or laundry, to wear gloves and a mask as they came in and out of buildings and met residents at the main lobby. I think that this new Board of Health order, as consistent as it is with our neighboring communities, and I look forward to hearing Josh's perspective on it, is great because we don't just live in our homes, we live in an area. And so it'll be very good for compliance and fostering or adherence to the guideline when we can go over the line into Marshfield or go into Kingston or into Duxbury to buy something or maybe at some point get a haircut. We all would like to get a haircut. That we're going to know what the protocol is because it's going to be very much similar to what we have here in Pembroke. So for the longest time, I've had residents, following the rule or the suggested guideline to wear a face covering, but they're very antsy and nervous and afraid when they saw people, exercising their personal privilege or right not to wear one. They may have been respectful of the 6-foot distance rule, but not wearing a mask did tend to make some people uneasy. Now the new Board of Health order is going to, for lack of a better word, provide the insistence or the teeth to require everybody to wear one. And I think that in the end, and we're getting close to it. And while Lisa says it will be around for a while, I do believe that it's going to be second nature for us to implement and maintain these new policies.
Thank you. One of the things we're seeing, to your point, on state and well, not state, but on federal news, is as some of these other states who are so far ahead of us in terms of their curve have tried slow steps to reopen. Facial coverings are still a part of that process. So this, to your point and to Lisa's point, is not necessarily new or different. It may become what we are looking for as we go forward, because I think a lot of people are interested in seeing what the future is going to look like and moving toward that. So the sooner everybody understands this facial covering need and potentially embraces it, it will work better as they transition out of the house. So thank you for that. Gretchen, I have a question for you about outreach, because I know that you've been around the clock providing the support that seniors and some of our economically challenged food and insecure folks have been having. So to that point, you work with Old Colony Elder Services, and this is a two-part question. How are your residents faring, and how is Old Colony Elder Services going? We don't hear much about them till we really need them. So I just wanted to know how they're doing and what you thought they were facing and how's it going?
Was that question generated towards me? Sorry, I got left off.
No worries at all, Gretchen. To make it very short instead of as long as it just was, I'm sorry for that. How are you folks doing? How are the outreach clients doing? How's Old Colony Elder Services doing?
So For the most part, everyone's doing pretty well. I still have staff reaching out regularly to some of the seniors, and we're coming up across, things that normally wouldn't happen. Say, with an Alzheimer's patient or progressive dementia, normally you're able to get help coming into the house to help relieve some of the stress. So you're finding that a spouse or maybe another family member is now the main caretaker of this person that is suffering. And I just want to, reiterate to anyone who is the caretaker that really a simple daily plan is really important. In the morning, get up at the same time, get ready for breakfast, have a conversation maybe over coffee, over an article in the newspaper. If it's nice out, take a walk. And then in the afternoon, you have your lunch at a regular time. Maybe listen to some music, do a crossword puzzle, and take a nap, play a game, and the same thing at night. Prepare dinner, have a conversation, reminisce over coffee after dinner or dessert, play cards or watch a familiar movie, and just on a regular basis, keep that up to help them.
Now, how many runs did you do last week?
We delivered to 40 different 40, I think it was 48 different residences for food. And we did our regular Meals on Wheels program every day, where I have a board meeting today at 10 with OCES because I'm on the board there to find out what we can do to help if there's any hiccups in their system. They have been very good with the caterer Lindley to be able to provide meals from day one. And we have been very lucky to have volunteers that will deliver those meals every day. But you just never know what's happening. So we always need to have a backup plan. And I think today our meeting will be if something is going to have to happen. But of course, they've dialed back on services because maybe a housekeeper isn't going in to service one of the residents that they usually do. But they are, in constant contact with them, as are we.
Very good. Thank you. All right, State Rep, you're up. Unfortunately, there was a lot that was just brought in your general direction, but almost all of it had that same theme and tenor. How are the communities working together? Are you seeing anything that really makes you proud or anything that really concerns you? Can you give an overall picture about how Pembroke and the rest of the towns that you represent are working together? And before you get started, I want to personally thank your staff. Cole and Gigi have been amazing. When we've had needs, they have stepped right in and really picked it up for us.
I will let them know. Thank you, Sabrina, and you guys have been amazing as well. It's been a great show of teamwork from a state and local perspective, and we'll throw the federal government in too. But yeah, no. To answer your question, honestly, I see Pembroke. I've said it from the beginning, has really been right on this from the beginning, and the steps that you're taking are consistent with what we're seeing happen in other communities. I represent the town of Hanson as well, and Duxbury, and Hanson has already adopted a facial covering policy. Duxbury has not yet. I believe they're meeting actually Wednesday night, and that's on the agenda. And I expect that will happen probably then. So Pembroke again is right at the forefront of doing all the steps that we'd expect and want to see. So I think keep on doing what you're doing. You're doing a great job. That would be my message, I guess. You're not, Pembroke's not an outlier. We're doing everything we should be doing, and I think typically a step or two perhaps in front of other communities. So yeah, I think it's all systems go. Lots going on. I wanted to just, Sabrina, update. We are this week taking a sort of first step in terms of the state government. We'll actually be having our first, what we call a formal session virtually. It's a big step for the legislature because obviously, if at some point we're going to have a state budget and make, take votes that, to keep things moving forward. And that's not always possible to do in this current sort of pattern that we're in. So on this Thursday, we're going to be having our first, and I guess, the history of the Commonwealth, I assume the first virtual formal session will be voting on legislation. It has to do with bonding because of the fact that we extended our tax filing deadline for residents to July, which is after the fiscal year. Obviously, we previously were counting on all that revenue to come in to help cover the costs of running the state and local aid and all the various costs associated with that. So having a big portion of that money being deferred to July means we're going to have a short-term cash flow issue as a Commonwealth. And so what we do is you issue what's called a bond anticipation note to cover that, which is a pretty common practice. But you need legislative authorization to do that, and it's not something that can be done in our informal sessions as I'm here now. Haha. So that's something we'll be doing on Thursday, doing our first formal vote. I'm not quite sure. We're having a meeting today to talk about how that's going to work, how the security around that is going to be. I'm quite interested to see how they've worked it out. I believe it's going to be like a PIN code. You're going to call in and register your vote. So that'll be kind of interesting. I don't know if exciting is the right word, but good to be getting to do that. Lots going on. You had mentioned, one of the speakers mentioned earlier about town meetings. I know that's a concern. I saw that the planning board had taken action about the flood maps, which is important. Obviously, town meeting is an issue for many towns. We already did delay the town meeting here in Pembroke, and the legislature gave cities and towns the authority to do that, and in fact gave them the authority to delay that every 30 days if they need to. So if the original date that we extended town meeting is not feasible at that time, then at the election of our board of selectmen and town moderator, they can continue it for another 30 days and continue that pattern until hopefully a time such that it is safe to have a town meeting. At some point, obviously, that gets to be more and more difficult to carry things on and to conduct the business that needs to get done by the town, such as adopting flood maps. And we're looking at different scenarios for things like that. We have given the towns the authority to do what we call 1/12 budgets, so that if that becomes necessary, if there's not a budget or a town meeting by July 1st, the towns can adopt that means. And we're looking at it as a Commonwealth as well. I mean, obviously, we're not going to have a budget on time. We don't always have a budget on time in normal times, and much less this time. And so, and probably it's to our benefit not to have a budget on time now, because the revenue picture would be drastically different than what we're likely to see. So a lot of moving parts, but there's been some tools given to cities and towns. But town meeting is going to be, I will say, it's going to be a little bit of a challenge, because I don't know that there's going to be a day in the too close future where that's going to be a realistic scenario to have a town meeting with people packed in a room. Some towns, like town of Plymouth, that have representative town meeting, there is legislation being looked at to allow remote town meeting in that regard. I don't know that that is realistic or feasible for an open town meeting where any citizen can come. So we'll have to take a look at that. I guess I would say that we're very fortunate once again to bring it back to Pembroke. I'll wrap up here that our town moderator, Steve Dodge, who's so well respected in his industry and well known, and has been part of the process and input for, in fact, drafting some of these town meeting related pieces of legislation. So we'll look to his guidance for figuring all this out.
All right, so it's on Steve now, huh?
Yes, there we go.
I was just going to say, yeah, so that's going to be a real challenge. And I was curious to know if there's any conversation now about how, relief for cities and towns to try to stand up. In Pembroke, we have a quorum of 150 people to open the meeting, and just trying to find a facility or some other avenue. I mean, we had Aaron Obi on 2 weeks ago, who said that the auditorium at the high school has 586 odd seats. So, how do you actually manage, and do you close it off? I mean, is there a protocol, or is there going to be some opportunity for the town to be able to set overflow and remote for in excess of a quorum achievement? But I apparently have to talk to Steve.
Yeah, I mean, some of those are different ideas that could be done. I mean, obviously, I think the safest thing to do would just be to continue it and
Sure.
to get back, until we absolutely have to have a town meeting.
Sure.
Things that can be handled without town meeting, then obviously we want to try to do that. And then if there comes a point where that's just not possible, then we set the parameters for the safest town meeting that can happen. With people like yourself and Lisa and Steve all kind of having input about how that gets managed. And if there's changes that need to be made at the state level, we'll try to pursue them. I don't know that it's realistic that we're going to see virtual open town meeting. I don't know how that would work.
No.
But Certainly, I'm happy to listen.
I was gonna say, it sounds like such a great idea, but moderating that would be, virtually impossible. Imagine 12,000 registered voters all trying to.
Right. You have a tough enough time keeping the six of us, in line on these shows. So imagine, having the whole town.
I defer to Steve Dodge on that one. He's good at that. But just as a last follow-up before we move on, and I do want to check in with Julie and see if she has any questions, but I wanted to ask you one last thing. Is there anything potentially to discuss regarding some of these federal deadlines and the ability to find another adoption mechanism? For example, we have a requirement from FEMA to adopt map panels. And now that the planning board has been able to close their hearing to advance that item, is there any conversation out there about trying to make an accommodation?
Yes, great question, and the answer is yes. For viewers who may not be intimately with what we're talking about, that there's a deadline coming up to adopt flood maps through FEMA, and normally that would happen through a planning board public hearing, which just happened, and then a vote of town meeting. And obviously, the town meeting vote may not happen by the time the deadline that we've been given by FEMA to adopt these flood maps, and that has implications. The maps are not adopted, not just for our own community, but for the region. So we are having conversations, and I can tell you, it's no secret. I had a conversation with the chairman of the municipalities committee earlier. I'm sorry, I was going to say earlier this week. It was actually late last week because the weeks all flow together about this precise issue. Because as soon as it was brought to our attention, we realized this was going to be an issue that this wasn't originally one of the things that was addressed when we passed the municipal flexibility bill. So he was very open-minded about that, and I explained to him what the situation was. And I believe actually we have Pembroke Town Council working on some draft legislation to make sure that it's going to meet the town's needs, and then we're going to file that. So I expect actually that could happen even as soon as today.
Brilliant, thank you. Julie, do we have any questions in at the moment?
We do. We have a couple. The first two would probably be for Lisa. And one of them came in on Sunday where someone said it was regarding Lowe's specifically, and how can the town of Pembroke allow so many people to shop at Lowe's at the same time? Someone should look into this.
Sure. So the capacity issue in any establishment, the governor has recommended 40% capacity on supermarkets. I'd have to look more deeply at the governor's orders, but it didn't specifically target other businesses. So obviously Lowe's needs to take a look at its operational safety plan for its own staff, because obviously a volume of persons to the number that occurred from what I'm being told Saturday and Sunday at Lowe's, it's not occurring midweek. It was a Saturday and Sunday issue, needs to be looked at. And the best way that Pembroke residents could encourage Lowe's to take those actions is to speak directly to them. And secondly, not to spend their money there if they're concerned about it. But the facial covering order will apply to Lowe's, and that will be something that they would be charged with if they were to fail to comply as an organization, as a company.
And if I can chime in on the back of Lisa on that one, Julie.
Sure.
We started receiving phone calls yesterday afternoon, and they got a little frequent after about 1 o'clock. And to Lisa's point, when this whole thing was rolled out, okay, when there was a lot of discussion, to everyone on the panel's point, a lot of good work was done to try to come to this consensus. And the chairman of the Board of Health pulled the trigger that he's authorized to pull under a health emergency, which was to require a facial covering when you're in an essential business. And we started getting phone calls in the selectman's office after 1 o'clock yesterday. Lowe's had posted someone at the door. They had a sign that was provided to them by the town. The town has actually produced some of these signs to require a facial covering in an essential business or governmental operation. And people weighed in on the selectmen's line with their feelings about that after 1 o'clock yesterday. So while there may have been some activity over the weekend, that activity has stopped, or at least has been more closely monitored by the corporate offices.
Okay, excellent. Thank you. This other one probably for Lisa too, and you might not know the answer. There is a lot of talk about carriers, people who have COVID-19 but are asymptomatic. Do you know how long they carry the virus, and therefore how long they are likely to infect others?
That's an awesome question. And that is something that the CDC and the best scientists are still working on. And I'm actually glad, while I can't answer the question, I'm glad the question got asked, because this is what people should be thinking about. This is still an emerging infectious disease. This is a new virus. So much is unknown about it. And I think there's a disconnect between the scientific and medical community and the general population, that somehow the scientific and or medical community doesn't care about what's happening to the economy or anything outside of the disease. And nothing could be further from the truth. But what the scientific community and the medical community are trying desperately to do, working around the clock in multiple labs, multiple organizations, is to get hard and fast determinations on all of these things, Julie. The effectiveness of a mask. How long does this live? How, remember before the Princess cruise ship was tested, we only thought it lived on hard surfaces for 3 or 4 days, maybe up to a week or so, until we learned very much the opposite from that particular scenario. So that is what's being worked on so diligently. So I think the idea that everyone should have in their head is there's still a lot to learn here. I'll liken it very sadly to the AIDS epidemic. If everyone remembers or was alive when that was coming to the forefront, again, for 4, 5, 6 years, so much was unknown about AIDS and how it was transmitted and who was the most likely to encounter it and become afflicted. And then why were some people that were afflicted more afflicted or more medically compromised because of it? COVID is no different. It's very interesting if you look at it from a scientific optic, if you can kind of detach from that emotional or the anger or the politics of the disease and just look at it as a disease. It is spreading really quickly, and we're not quite sure why it so aggressively spreads. It's definitely afflicting men more than women and more severely. We don't know why that's occurring yet. We don't have a hard and fast deadline on how long this is going to live on surfaces and outside the human body. We don't know. We know how virulent it is, but we don't know how easily it's spread, how easy it is to pick it up from a contact surface. So these are all the questions that everyone's working on. But I'll flip back to the statement I made earlier that, yeah, of course the economy has to open up. Of course businesses have to open up. So if we don't know the answers to all these questions, yet we want to open all these businesses, how do we do so? Well, the only way we can do that is by changing our behavior. So what we do know for certain is if someone is a carrier, liquid drops from within their body have to leave their body and have to be ingested by someone else. Therefore, we know one of the ways to minimize the opportunity for that to occur is by wearing a facial covering. And the facial covering captures the liquid that would leave your mouth or nose and prevents it from going into someone else's mouth and nose. And if they're wearing a facial covering, that's going to limit their opportunity to ingest said bacteria. It's also going to limit your ability to transfer it onto solid surfaces where someone else could touch it and then touch their face, nose, and eyes. As far as a hard deadline, we don't have one. As far as a hard deadline of living on different surfaces, we don't have one. So I guess the whole thing here is better be safe than sorry. And this is one of those situations where if everyone can become more accustomed to wearing facial coverings when around other people, we can really kind of curb this beast and get it under control. And when everyone adjusts their thinking to saying, okay, I'd rather wear a facial covering and be able to do some of the more normal things in my life, that is when, the governor and other businesses are going to be able to thinking about opening up safely. Because at the end of the day, I would like to think no one wants to be responsible for anyone else's death.
Yeah, thank you. Another related question sort of is, and this has to do with really any public area in the outdoors. For example, if I walk in a local nature preserve without a mask, walking a moderate pace, and I happen to pass somebody 2 feet away who is also not wearing a mask, what are my chances of getting this if they have it? But also, it really is begging the question: do you recommend that people in the outdoors also wear a mask if it's in a public area?
Wearing of facial coverings outside is not a requirement as yet. If you think you're going to be in a highly densely populated outdoor space, and I'll be mean, I'll pick on it. Let's pick on the Herring Run in the center of Pembroke. It certainly is one of the most popular outdoor destination locations to be at. So the short answer to your question is yes. If you're briskly exercising and you pass someone within 2 feet, there's a very good chance they have huffed or puffed or breathed out particulates into that area. And if you're passing the other direction and you walk into that cloud of particulates, yeah, there's a very good chance you could ingest some of those particulates. So the short answer is, if you're asking from a scientific optic of I want to be safe, yes, you should. If you're within 6 feet of someone, you should want to minimize your opportunity to breathe in any of their bodily fluids without getting too gross. So yes and no simultaneously. If you can be outside and maintain social distancing, no, there's no benefit to wearing a mask if you are not within that proximity where you're going to breathe in someone else's bodily fluids. Should you, if you're outside on a trail, and this is what I personally do around the cranberry bogs when I encounter someone else, I find a spot off trail. If I see someone else coming in the opposite direction, I look for a side trail or a place where it's a little wider or a place where I can get off the beaten path, and I let that person pass, and they pass at a safe distance, and then I continue my walk. That is the optimal thing if you do not have a face covering on. But if you know you're going to an outdoor space where there is a very good chance of a lot of congestion, you should reconsider your own personal safety as well as the safety of others.
Thank you. Good advice. This is for Josh Cutler. Yesterday at 10:30 a.m., the second round of the Paycheck Protection Program was to be launched. And there were an awful lot of small businesses who were really looking forward to being able to reapply that did not receive those funds the first time around, but it did crash. Do you have any update on that?
Yeah, I'm aware of that. So the SBA has a system colloquially we called E-Tran, and basically the way it works is the PPP loan, the Paycheck Protection Program loan, you apply through your local bank, and then they do the underwriting and so forth and documentation. Then they submit it to the SBA through the system called E-Tran. And so yesterday at 10:30, the E-Tran system was to be reopened with the new funding. Congress appropriated another $310 billion. Obviously, we had a whole week plus of time where there was no funding. You can imagine the buildup in applications for people who either A, didn't get the funding the first time or then heard about it and wanted to apply. And so the volume was such that initially, I believe the site just crashed. My understanding is that applications were getting through, but there is, obviously some significant bandwidth issues. The SBA, and this is more technical than I'm familiar with, but they have an HTML system that they use, and they were getting like 15,000 applications per hour, and issued. So I'm hopeful that they've sort of worked that out a little bit. It's still a concern. I think obviously the program I think could have been set up a little bit differently to make sure that money got into more of the hands of truly small businesses rather than sort of big businesses. But we're sort of dealt the hand we have, and I would just stress to anyone listening, any business that's interested in this, to make sure you're talking to your bank on a regular basis. If you haven't already applied for the PPP, you really should immediately. It's going to be challenging to get in line at this point if you haven't already, because there's such a demand. There are some other options. We've talked about them on past shows. EIDL, the Economic Injury Disaster Loan, is another option where you're dealing directly with the SBA. And just one other thing I wanted to mention, Julie, that hasn't got as much attention, but maybe it sounds complicated, but it actually has quite a significant benefit for many businesses, is the employee retention tax credit that can give you up to $5,000 per employee in tax credits. And it's not something you have to apply for. It's not something you go to your bank for. It's actually something, a credit you claim on your taxes that you pay to the IRS or the state, and you reduce your tax liability to that. Or in some cases, if you qualify, you would actually get money directly from the Treasury Department, the IRS, back. So that is something that the ERTC, Employee Retention Tax Credit, that I would urge anybody listening to that might run a small business to look at, especially if you got shut out of the PPP, because you can't do both the PPP and the ERTC. How's that for a little acronym?
Yeah.
Tuesday morning.
Yeah, I was just going to say that. You can't do both. Yeah. And
Julie, do you mind if I just jump in
Oh,
with the
please do.
local, the grant that Pembroke applied for to provide some small business relief? Is there any conversation about trying to make more of that kind of a product available at the municipal level for the folks who actually work with some of these really smaller businesses?
Yeah, so Pembroke applied for, the Attorney General came out with a grant program, a sort of a micro grant program for small businesses to be run through municipalities, which was great. And Pembroke applied on the first day it was available. So kudos to Pembroke, obviously, again, for being right on top of that. In fact, yesterday I checked in with the Attorney General's office just to kind of say, hey guys, what's the status of this?
How's it going?
They said they're still reviewing the applications. They got such an overwhelming response that they immediately had to close applications. So again, it was smart that the town got their application in right away. And that's the case with everything. I just strongly encourage everyone to be right on the ball with these things because there's such a need, unfortunately. So we're hopeful there'll be some funding. I can tell you it's anything that's out there, there's just such a need and such a demand, it's instantly getting overwhelmed. And that is sort of the issue that we're grappling with. When the state came up with its own small business relief fund back in the early days of this in March and put $10 million in, that was gone in a week's time. And that was truly limited to small businesses. So we recognize that there's an incredible need, and I think it's trying to be filled, but it's not, it's like shoveling against the ocean in some respects.
And one final follow-up on that, Josh, there's talk about a third and even a fourth stimulus package from the federal government.
I think we're on 4 now, aren't we? 4 and 5?
4 and 5, depending on how long this goes out. Can you give people any kind of look into the future as far as where you see that might be coming in?
Sure. Yeah, happy to. Again, just to reiterate, I am a state representative, not a congressperson. But nor do I have any aspirations to ever do that. Congress is actively debating, discussing having another iteration of the CARES Act to provide funding partially for state and local governments. That is one consideration. I think there's seems to be consensus. Congressman Richie Neal, who's represents Western Massachusetts and is one of the senior members of Congress, Chairman of Ways and Means, it talked about this the other day that he's looking and pushing to have another round of funding, especially specifically for state and local governments. Mm-hmm. So that would be welcome news. But again, it's Congress, and they have their own challenges and have to work things out just like we do at the state level. Fingers crossed, I guess.
Right.
I don't have any insight other than that.
Okay, and we do have to remember that our towns need money too. The towns need to function. We need to provide the services that everyone expects in the towns. And if they're not getting their income, there's got to be another way for them to get help. So that's what that speaks to. Thank you, Josh.
Oh, by the way, they've incurred a significant number of expenses that weren't expected as well.
Absolutely, right. You got hit on both sides. Sabrina, that is all the questions that I have so far from today.
Well, it was a beautiful turnaround because I was about to mention that the selectmen today at 3:00 are going to start to discuss budget reductions for fiscal 20, just so we can try to balance where we are, let alone start the 1/12 budget or go into fiscal 21 planning because of the constantly moving revenues, streams that have closed off, dried up, or slowed down. And some of these hopefully are just slowly stalled, and they will start to come back online, and that would be obviously optimal. But the selectmen have to start having those discussions, and they're going to start having them today about what does it look like when you have to start figuring out how to balance with less revenue. And it's not something anyone really wants to get too deeply into, but sometimes, that's what has to happen. And the selectmen, no one envies them right now because there's a lot of decisions to be made. And they will begin those discussions at 3:00 today on Comcast Channel 15 or live streamed on PACTV. And thank you for that as well, Julie.
Sure, that's great.
Yeah, and I want to bring this back around to a hopefully more positive note because that's kind of sad.
Yep.
Lisa, as we go off, because I think we're going to pretty much end it here, I did want to ask you, since Julie asked Josh to look in a crystal ball, I'm going to ask you to do the same thing. The governor is set to speak today, and it has been widely anticipated that there will be an address of the May 4th deadline. But having said that, I would like to ask you a two-part question. What do you anticipate could come out of a deadline extension, which is hopefully going to be the last deadline extension? And what kind of messaging do you think he would couple with that to talk about phasing in a future reopen? It's all right, Lisa, go ahead.
I love it. So crystal ball time. Ooh. So if I had a crystal ball with the information that I'm privy to that the governor has, which I'm not privy to all the information that he has, but using what I have available, the data models being done by the medical community like Mass General Hospital and others do show that if we come out of this quote unquote shutdown too drastically and too quick, we will just see a whole new spike. We will see a whole new spike of cases, a whole bunch more loss of human life, a whole bunch of more people afflicted, which is not what any of us want. So crystal ball, we're still in a peak. There's no doubt as I look at the numbers, the state dashboard, any dashboard you want to look at, we're still pretty high. If that's going to go down in less than 7 days, I'm going to be surprised. It's not impossible, but I would be surprised. I will counter that with the governor, in my opinion, has been, and I applaud this, very conservative. And I know dealing with the media and dealing with businesses cannot be easy at a time like this. This is a very brutal, tight line to walk of, hi, people are dying and no one's doing anything about it. And businesses and the economy are crashing and no one's doing anything about it. So that's a very, very, very tough line to walk. So I'm going to go crystal ball. The governor's been very conservative. I think he's going to extend the deadline by 2 weeks, if I'm reading him correctly, which is sometime around May 18th. I had originally said May 25th, but again, he's being really conservative, so I'm going to go May 18th. The only reason I think it might be May 25th, because I think the governor and all his advisors are going to have some extreme concern with the holiday weekend and people's behavior. Unfortunately, we've seen time and time again on really nice days, really times that people want to be together as families or groups or friends, people are making bad choices, unfortunately, from time to time. So I think the governor's got to be looking at the holiday weekend, and it has to be concerned that if the restrictions are lifted before then, is that going to be cause for everyone to say, let's have a parade, let's have a party, let's have a cookout? I think that has to be considered, but I'm thinking he's going to go with May 18th or thereabouts. And I think when he does start reopening businesses and everything else, I think it's going to be a phased reopening. I think he's going to choose businesses of a smaller size that can do so safely without too many people in a location. I think it's going to come with recommendations and guidelines for facial coverings. I think it's going to come with recommendations and guidelines to eliminate any shared workstations wherever possible. I think it's going to come with guidelines for sanitation on a regular cycle. And things like that. That's what I expect to see. I think there's going to be a phase 1, 2, and 3 reopening. I think that the governor is going to roll out those phased reopenings based on what he sees, just like Pembroke's doing locally, based on what he sees happening with each phase. If they see evidence of people being dangerous and taking unnecessary risks, I think that's going to slow the phased opening. And I think if the governor sees businesses and people doing the right things and wearing facial coverings and business owners being responsible and creating as safe a work environment as they can, I think that's going to encourage the governor to move forward.
Thank you. And as our final note, the most positive and optimistic note we could leave on, Gretchen, would you please talk about the Hope Fund?
Absolutely. The town of Pembroke has established the Pembroke Hope Fund, and that is for any resident that may be having some financial difficulties during this, challenging time. So if you go, currently we're working on trying to get a donate button right on the very front of the webpage. But if you go to the town's webpage and go to the bill page link, you'll just click on that and then click on the link itself once the page opens and go to the treasurer's department. There is a link there that will bring you right to the Pembroke Hope Fund. And any donations that you make to that fund, 100% of those donations will go to one of your fellow residents that are currently in need. And as we go forward next week, we'll probably put an application that anyone in town can fill out and send into the town hall, and we'll take a look at that and see how we can help you.
Thank you, Gretchen. And just as a quick update, we're getting notes right now from the library director, who's working very hard on creating that nice icon button, make it as simple as possible for people to do what they've been asking to be able to do, which is give back and try to make the situation better. So hopefully by noontime today, that new button will go live. And I want to thank the representative and thank you, Gretchen, for making that happen. That was a really smart move, and I'm sure everybody's very grateful. I want to thank everybody and welcome you, or thank you for coming back. And when we meet next Tuesday, hopefully we have some really upbeat, positive things to bring forward. And I want to turn this back to Julie. Thank you, Julie.
Thank you, Sabrina. And we will see you on Thursday also, because it's every Tuesday and Thursday at 9 o'clock in the morning. We have the COVID-19 update for Pembroke. And do, as Sabrina said, today at 3 o'clock on Comcast 15 in Pembroke and pactv.org/live, we will bring you that selectmen's meeting, which, like Sabrina said, they have a lot of really important things to discuss and decisions to make. We thank you for joining us. Please do send in questions anytime you have, even if it's not during one of our broadcasts, to pembrokeinfo@pactv.org, and we will make sure that the guests answer the questions that you have. Social distance, wash your hands, please try to stay positive, and we'll see you on Thursday.